NCLEX question banks. Without further ado, let's dive into the questions now.
Number 1. A nurse is caring for a client with heart failure who has been prescribed furosemide, also known as Lasix. Which assessment finding requires immediate intervention? The answer is B. Serum potassium level of 3-furosemide is a loop diuretic that can cause hypokalemia. A potassium level of 3 is below normal, 3.5 to 5.0, and increases the risk of cardiac dysrhythmias. Immediate intervention, e.g., potassium supplementation, is needed to prevent complications. Number 2. A client with a history of chronic obstructive pulmonary disease is receiving oxygen therapy at 4 liters per minute via nasal cannula. The nurse should answer B. Encourage pursed lip breathing. Clients with COPD have chronic CO2 retention, and too much oxygen can suppress their drive to breathe. Pursed lip breathing helps slow exhalation, prevent air trapping, and improve gas exchange. Increasing the oxygen flow rate can be dangerous in these clients. 3. The nurse is caring for a postpartum client who is Rh negative and gave birth to an Rh positive baby. Which action is priority? Answer A. Administer Rho-D immune globulin, RhoGAM, within 72 hours. If an Rh-negative mother gives birth to an Rh-positive baby, she must receive RhoGAM within 72 hours to prevent Rh sensitization, which could cause hemolytic disease in future pregnancies. 4. A nurse is caring for a client diagnosed with myasthenia gravis, MG. Which meal option is most appropriate for this client? Answer B. Mashed potatoes with ground turkey and gravy. Clients with MG have muscle weakness, including the muscles used for swallowing. Soft, moist foods are the safest option to prevent aspiration and choking. 5. A client with type 1 diabetes is found unconscious with a blood glucose level of 40 milligrams per deciliter. What is the nurse's priority intervention? Answer C. Administer V-dextrose 50%, D50. A blood glucose level of 40 milligrams per deciliter is severe hypoglycemia, and the client is unconscious, meaning they cannot take oral glucose safely. IV dextrose is the fastest way to restore blood sugar and prevent complications like seizures. The nurse is assessing a client who has just received morphine for pain relief. Which finding is most concerning? Answer A. Respiratory rate of 8 breaths per minute. Morphine is an opioid analgesic that can cause respiratory depression. A respiratory rate below 12 breaths per minute is concerning, and a rate of 8 breaths per minute requires immediate intervention, possibly including naloxone, Narcan. 7. A client with a deep vein thrombosis, DVT, is receiving heparin therapy. Which laboratory value should the nurse monitor closely? Answer C. Activated partial thromboplastin time. Heparin therapy affects the intrinsic clotting pathway, and the effectiveness is monitored using a PTT, which should be 1.5 to 2.5 times the normal range, 25 to 35 seconds. An INR is used for warfarin Coumadin, not heparin. 8. A nurse is preparing to administer digoxin to a client with heart failure. Which assessment finding requires the nurse to withhold the medication? Answer: B. Heart rate of 48 beats per minute. Digoxin slows the heart rate, so it should be held if the HR is below 60 beats per minute. Bradycardia, nausea, and blurry vision may indicate digoxin toxicity, which can be worsened by hypokalemia. 9. A client with cirrhosis is receiving lactulose. The nurse knows the medication is effective when the client. Answer: B. Has 2 to 3 soft bowel movements per day. Lactulose is given to reduce ammonia levels in cirrhosis clients. The goal is 2 to 3 soft stools per day, which help excrete ammonia and prevent hepatic encephalopathy. 10. A client is admitted with severe burns. Which IV fluid does the nurse anticipate administering first? Answer: B. Lactated Ringer's rationale. Lactated Ringer's, LR, is the fluid of choice for burn resuscitation because it contains electrolytes and helps correct fluid shifts and metabolic acidosis.